Very good evening to all of you. Today we are going to do deal with the subject of anatomy. Anatomy carries a huge chunk of questions, about 15 questions, 16 questions from anatomy in the NEET PG exam usually come. In INICT exam also about 10 to 12 questions come. And the basic knowledge of anatomy will help you in solving many questions in different surgical subjects also. So let's begin with the first question of anatomy. Which is a typical intercostal nerve? Which is a typical intercostal nerve? A first, B second, C third, D seventh. See, typical intercostal nerves are the nerves that are confined to their own intercostal space in the thoracic wall. The third, fourth, fifth, and sixth intercostal nerves, third, fourth, fifth, and sixth intercostal nerves are typical intercostal nerves. So in the option, you can see the C option is third. So the correct answer here is C, third. Trendelenburg test is very important. Trendelenburg test is positive due to injury to which of the following nerves? A. Obturator, B. Sciatic, C. Superior gluteal, D. Inferior gluteal. Now, a positive Trendelenburg test is relatively non-specific. Positive Trendelenburg test is relatively non-specific and may indicate pain due to osteoarthritis of hip joint, weak hip abductors, gluteus medius minimus, short femoral neck or fracture of neck of femur, dislocation or subluxation of hip, neuropathy, gluteus medius and minimus are supplied by superior gluteal nerve. Now, a little bit about Trendelenburg test. Normally, when a person is made to stand on one leg, the hip abductors of the ipsilateral side raise the opposite and the unsupported side of the pelvis. If the abductor mechanism is defective, the unsupported side of pelvis drops, and this dropping is known as positive Trendelenburg test. Since the nerve involved is a superior gluteal, so correct option here is C, superior gluteal. Which among the following is not a branch of arch of aorta? Now, this type of questions are usually asked the branches of abdominal aorta, branches of thoracic aorta, and the sub-branches. Branches of arteries is a favorite question in the NEET PG and INICT exam. So, which among the following is not a branch of arc of aorta? A. Brachiocephalic, B. Right common carotid, C. Left common carotid, D. Left subclavian. Now let us look into the details of arch of aorta. The arch of aorta begins at the level of upper border of second sternocostal articulation of the right side. The branches given off from the arch of aorta are three in number. Number one, brachiocephalic artery. Number two, left common carotid. And number three, left subclavian. So it is brachiocephalic, left common carotid, left subclavian. Look at the options. They are there. Brachiocephalic, left common carotid, left subclavian. So not means right common carotid artery is not a branch of aorta, arch of aorta. So the correct answer here is B. Boundary of Koch triangle is not formed by A. Tricuspid valve ring, B. Coronary sinus, C. Tendon of Todaro, D. Limbus fossa ovalis. Now this Koch triangle is a triangle enclosed by the septal leaflet of tricuspid valve, the coronary sinus, the membranous part of interatrial septum. Koch Walter Karl Koch, 1880-1962, was a distinguished German surgeon who discovered a triangular-shaped area in the right atrium of heart that marks the atrioventricular node known as Koch triangle. The three sides of triangle are defined by following structures within the right atrium. The ostium of coronary sinus posteriorly, the anterior portion of tricuspid valve annulus, and the tendon of Todaro posteriorly. Importance: it is used as an anatomical landmark for location of atrioventricular node during electrophysiology procedure such as pacing or ablation. So the correct answer here is limbus fossa ovalis. Sympathetic supply to heart arises from which of the following spinal segments? A. T1 to T5, B. T2 to T6, C. T3 to T7, D. T4 to T8. Now, this sympathetic nerve supplying the heart are located in the intermedial horn of spinal segment T1 to T5. Sympathetic supply is cardio-acceleratory, means it increases the heart rate, and on stimulation they increase the heart rate and also dilate the coronary artery. Both parasympathetic and sympathetic nerves form the superficial and deep cardiac plexus, the branches of which run along the coronary artery to reach the myocardium. So the correct answer here is A, T1 to Inferior pancreaticoduodenal artery is a branch of which of the following arteries? A. Splenic artery. B. Left gastric artery. C. Gastroduodenal artery. D. Superior mesenteric artery. Now, this inferior pancreaticoduodenal artery is a branch of superior mesenteric artery. This inferior pancreaticoduodenal artery supplies the pancreas and adjoining part of duodenum. Its anterior and posterior branch anastomose with the branches of superior pancreaticoduodenal artery. This anastomosis is the only communication between the arteries of foregut and midgut. The branches of superior mesenteric artery are inferior pancreaticoduodenal artery, jejunal and ileal branches, ileocolic artery, right colic artery, and middle colic artery. Now, once again, the branches of superior mesenteric are inferior pancreaticoduodenal artery, two jejunal and ileal branches, ileocolic artery, right colic artery, and middle colic artery. So the correct answer here is D, superior mesenteric artery. Facial nerve is a derivative of which of the following branchial arch? A. First arch, B. Second arch, C. Third arch, D. Fourth arch. This facial nerve is a derivative of second brachial arch. Muscles of the facial expression derived from it are buccinator, auricularis, frontalis, platysma, orbicularis oris, orbicularis oculi. Additional muscles supplied by it are stapedius, stylohyoid, and posterior belly of digastric. So the correct answer here is B, second arch. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint. It is a 2-day masterclass covering all the 19 subjects in a holistic manner so that you revise it. It forms a solid base for your revision so that you score a very good rank in your NEET PG. The main problem is revision. If you revise well again and again, the chances of getting a good rank increases as you revise and practice again and again. So let's move to the next question. Which of the following nuclei belong to general visceral efferent nuke column? A. Facial nerve nucleus, B. Trigeminal nucleus, C. Dorsal nucleus of vagus, D. Nucleus ambiguous. Well, the correct answer here is, what is the correct answer? Any guess? Now, let us look into the details. Visceral afferent fibers, also called general visceral afferent fibers, convey sensation from the alimentary tract, heart, vessels, and lung by way of nerve 9 and 10. A specialized visceral afferent component is involved with the sense of taste. Fibers carrying gustatory impulses are present in cranial nerves 7, 9, and 10. The general visceral afferent column is represented by part of dorsal nucleus of vagus nerve. So the correct answer here is dorsal nucleus of vagus nerve, that is C. Internal anal sphincter is a part of A. Puborectalis, B. Deep perineal muscle, C. Internal longitudinal fibers, D. Internal circular fiber. Now, the involuntary internal anal sphincter is formed by thickening of circular muscle layer, that is a circular layer of muscularis externa, a smooth muscle of upper end of anal canal. The sphincter remains in a state of tonic contraction most of the time to maintain the resting tone or pressure and to prevent leakage of fluid or flatus. Its contraction is maintained by sympathetic fibers from superior rectal, that is periarterial, and hypogastric plexus, and inhibited by parasympathetic pelvic splanchnic nerves. So the correct answer here is D, internal circular fibers. Which structure passes behind the inguinal ligament? A. Femoral branch of genitofemoral nerve. B. Femoral vein. C. Psoas major. D. All. The correct answer here is D. All. These femoral branch of genital femoral nerve, femoral vein, and psoas major. They all pass behind the inguinal ligament. Please click the link in the description box to join the 2-day Neet PG Ultimate Breakthrough Blueprint. It will definitely help you in your preparation in NIINSCT also, as well as Neet PG also, and any other exam you are preparing. Even final MBBS students can attend this class. It will give you a blueprint for your revision, and the faster you revise, the more number of times you revise, the there is a direct proportion to the better revision, better rank. Posterior communicating artery is a branch of A. Internal carotid, B. External carotid, C. Middle cerebral, D. Posterior superior cerebral. It is a correct answer here is internal carotid. Primary and secondary palates are divided by A. Greater palatine foramen, B. Canine teeth, C. Alveolar arch, D. Incisive foramen. It is incisive foramen. The right suprarenal vein drains into A. Inferior vena cava, B. Right renal vein, C. Right gonadal vein, D. Left renal vein. It is the inferior vena cava. Orebach plexus is present in A. Colon, B. Esophagus, D. Stomach, D. All of the above. The correct answer here is D. All of the above. Intercalated disc is present in A. Cardiac muscle, B. Smooth muscle, C. Skeletal muscle, D. All. Intercalated disc is present in the cardiac muscle. Which is true about synovial joint? Stability is inversely proportional to the mobility. B. Hyaline cartilage covers articular surface of all synovial joint. C. Metacarpophalangeal joint is a hinge joint. D. Cartilage usually divides the joint into two cavities. The correct answer here is yes, stability is inversely proportional to mobility. Nerve supply of stapedius is A. Second nerve, B. Third nerve, C. Fifth nerve, D. Seventh nerve. D. Seventh nerve. Small muscles of hand are supplied by C3, C4, C6, C7, 5, C8 to T1. All small muscles of hand, thenar, hypothenar, interossei, lumbricals are supplied by median and ulnar nerves, which originate from C5 to C7 and C8 and T1. So the correct option here is D, C5 to C7, C8 to T1. Structure passing deep to flexor retinaculum at wrist is A. Ulnar nerve, B. Median nerve, C. Radian nerve, D. Ulnar artery. It is the median nerve. Hypoglossal vein drains into right subcostal vein, B. Superior vena cava, C. Brachiocephalic, D. Right ascending lumbar vein. So the correct answer here is B. Superior vena cava. Superficial inguinal ring is a defect in. We all know the correct answer is external oblique aponeurosis. Ovarian artery is a branch of A. Renal artery, B. Internal iliac artery, C. Abdominal part of aorta, D. External iliac artery. It is abdominal part. Please click the link in the description box to join the ultimate 2-day Neet PG Tech through Blueprint. Meckel's cave is related to A. Submandibular ganglion, B. Trigeminal ganglion, C. Otic ganglion, D. Pterygopalatine ganglion. It is B. Trigeminal ganglion. Medulla oblongata is derived from A. Telencephalon, B. Diencephalon, C. Mesencephalon, D. Myelencephalon. It is myelencephalon. Longest spinous process is seen in A. C2, B. C4, C. C5, C7. It is C7.